All right, so we're going to do NG tube and internal feedings. So one, you need to check your physician's orders. Once you have checked the physician's orders, you need to verify the patient and you need to collect your equipment. So then you'll go in the patient's room, make sure the patient has something to drink, usually with a straw, ice chips, something like that, because they're going to need to swallow while you're inserting the tube. Go wash your hands and put on clean gloves. Then you'll need to measure out the tubing. So measuring the tubing, you will take the end of it at the nostril. You'll go over to the earlobe with the tubing, pull from there all the way to the xiphoid process. At that point, you'll need to tape that section, kind of like a marker, to see when you're inserting the tube. It kind of gives you a stop point. Now, you will need to make sure that both sides of the nostrils are clear. So what you do is you'll close off one, have the patient breathe through the other one to make sure it's clear. So once this is done, make sure your patient is in a high Fowler position, which is upright position. Then once they are at upright position, you will give them their liquid or the ice chips, whatever they're using to swallow. If they can do a chin to chest position, that would be good. So you'll have them do that. Once that is done, you will get the end of the tubing and you will put it in a water soluble lubricant 3 to 4 inches. And then once they get done 3 to 4 inches, then you will start inserting the tube. While you're inserting the tube, make sure the patient has like a towel around them, an emesis basin, because there is a chance that they will vomit, because you are going to be irritating that low gag reflex. So you have your tubing, then you will take it and you will slowly insert it downwards and back. So you will start putting the tubing in, having the patient swallow while you're doing this, and if they can do a chin to chest, that would be good. You'll push all the way in until you reach the tape. At that point, you'll stop, you'll pull it around to the side of the patient's face, and you'll need to tape each other's face. So then you will need to make sure that you're in the correct area. So you'll need to aspirate a little bit of the gastric contents and check the pH. For any reason the patient starts coughing a lot or getting winded or anything like that, and you get a lot of resistance, you need to pull out, because most likely you are in the lungs and you don't want to be in there. So you'll check the pH. If it is good, then great. Then you'll also need to get a KUB to check for placement. KUB is just like an x-ray of your abdomen, so you'll be able to check the stomach that way and be able to see the tubing in the stomach. After this is done, then you'll hook it up to whatever feedings they're going to be getting, clamp it off, whatever the physician's going to be using it for. You'll make sure that you do good hand hygiene and wear gloves. With the internal feedings, you will go in the patient's room, identify the patient, physician's orders, double check everything, whatever contents you're going to be using, whatever supplemental feeding should be using. Make sure you shake it up really good, because you don't want any sediment. You'll shake up the contents. So then you'll go to the patient. You'll need to aspirate some of the stomach contents. If you go over 250 ml, check it again in an hour. If it's still over, you will not do feedings. If you have more than 500 ml, you will not do feedings. If it's less, 250 and less, you'll have to put the contents back into the stomach. Then you are good to go. So what you'll do is you'll actually get 30 ml of water. You'll push it through the tubing, because we're trying to prevent the tubings from getting clogged, because you don't want to have to do the whole procedure over again. So put 30 and push 30 ml into it. Then you'll get whatever feedings it is. You'll hook the patient up. It could be a bolus feeding, which uses gravity. It can be a feeding through a pump, so whatever you're using. Then once the feeding is complete, you need to go ahead and push 30 ml of water back through the tubing. Now, if you have a continuous feeding, you will go every 4 hours and you will push 30 ml of water through the tubes every 4 hours with continuous feedings. You will also need to check placement every 4 to 6 hours. You do have to change out everything, the bags and stuff, every 24 hours. But a lot of times, though, you just need to make sure you monitor everything. Make sure the patient is sitting in a high Fowler's position at all times whenever you're doing this, because you don't want the patient to vomit or have any issues with that.